Okay, so I left off talking about relationships, and just to kind of wrap that up, I know everybody, teach his own, but for me, I just feel like waiting until I'm in a better space is just makes more sense. And who knows how I'll feel tomorrow, but that's how I feel today. And just going forward, these videos and my story is my story, and this is my journey. So if I don't say this is from my perspective, I don't assume that anyone else has the same. Everyone goes through their own life journey, so I'm not trying to, you know, put my views on anyone else. It's just coming from my experience. Um, the other thing that I think it's important to know is that all of these changes that I'm making, it's a lifetime choice. This isn't like a diet or any kind of short term type of quick fix thing. These are lifetime changes. You can not smoke ever again. You cannot use a straw. I mean, you could do those things, but it can result in serious complications. So that for me is a big no-no. You have to take vitamins for the rest of your life. You can't overeat. I mean, you could, but you're gonna have a huge consequence if you do. So, you can't take certain medications anymore. You're always going to have to follow up with your doctors. There's a lot of things that make you accountable because if not, if you don't follow through with it, your life and your health can be at risk. So I think that's important to know. Um, what else? So medical and mental health. For me, being bipolar, my mental health is a very large piece of the puzzle. Um, I don't think that people who have mental health disorders are all the same. I don't feel like we should all be lumped in the same category, but I think there are similarities. And one of those things, I hope for other people that it works, but for me is therapy. It works for me. Therapy helps a lot, and I go weekly because I need that much help to get through my life. And without it, I don't think I'd be ready for surgery. I don't think that I'd be able to handle all the stress and all the emotional demands and all the psychological demands that this journey takes. And I mean, that's in addition to the support I get from my friends and my family. So I think that if anyone in general, I think you should be looking into therapy or looking into a support group or at least some way that you can, dialogue and that you can talk each week and, you know, cry with, talk with, whatever it is that you do that, kind of gives you some self care. You should invest in that because getting through this process is not, it's not as easy as it may seem. For me, it also meant the mental health piece. It also meant that I have to make changes in my medication because absorption rates are different after surgery. Also, because I'm having the gastric sleeve, they're cutting out 80% of my stomach, and some of my medications are absorbed in the stomach. So that means you have to change them so that they get absorbed in the intestine, lower intestine. So I also have epilepsy, which um, my medication for epilepsy also was absorbed in my stomach. So I had to go from an XR, extended release, to a regular drug so that it can get absorbed lower in my body, um, which brings forth some concerns about having seizures due to the switch. So that's a precaution that we have to look at, fall precautions and seizure precautions right after surgery. So that's a little bit of a concern from my neurologist, but we're looking at it and taking care of it. And she's ordered some extra medication to be put on board, through the anesthesiologist while I'm in surgery and after. Um, just to make sure that there's, less risk for seizure. And I happen to have the kind of seizure disorder where I can have any type of seizure. So that kind of makes it a little challenging just to because we don't know. It could be a grand mal, it could be a petite mal. We have no idea what it would be if it happened. I haven't had a seizure since 2001. I like to keep it that way. So, after surgery, we're trying to figure out the support plan because, for the first at least week, I'm going to need to be with someone at all times just to ensure that if on the odd chance that I do have a seizure, I'm not alone, so because when I have a seizure, none of my limbs work. I go straight down. So if I'm falling forward, I'm on my face and on my stomach. And if I'm falling backward, it's straight on my rear and my back. So, um, that's just something that we're working into the aftercare plan. And speaking of aftercare, that's another big part of the surgery. Getting some support in place beforehand is really important. You have to do your intake very slowly after surgery. So I think it's like a sip over 15 minutes or two sips over 15 minutes for the first 3 days. So, keeping up with all of that and keeping up with, when you took your medicine and, how much you walked that day and, when you should do certain things. That's something that I think other people can help you keep on track or stay on track with. So I think that having, a team in place is kind of important, let alone just dealing and coping with the changes and the pain and the recovery aspect is going to be big too. It's like I said, this is kind of surreal that it's in 4 days. I feel kind of numb that it's happening now. I feel like I've fought for so long to get this, and I've fought really hard, and I've made a lot of changes that I'm really proud of, and it feels like for the first time in months, I don't have to fight anymore. It's actually happening, and I'm really excited about that. Finally, I will talk about getting ready for the hospital. So I am filling out advanced directives so that my mom and family can make decisions if anything does happen. Because you can die in surgery, and that's any surgery. And this surgery has risks associated with it, a lot of risks. It could be bleeding, there could be leaks. You could have a problem with your spleen because the spleen is really delicate and it's attached to the stomach, and there's really, really intricate little veins and blood vessels. And then there's the gallbladder, which is later on down the road, probably. If there was a problem, it'd be later on down the road. But so there's problems that could come up, and death is one of them. So filling out an advance directive is kind of important, I think, so that if something does happen or, you end up on life support or something, or if that's an option, then, if that's not what you want, your family can make that decision for you. So I did, and I think not just filling out the paper, but having the conversation with your family, which I did. Had the conversation with my friends and with my family, with my mom specifically, and with my sister. So, in addition to that, I also am filling out a will and getting it notarized so that it's legal. Because, I don't have a lot, but the things that I do have, there's certain things I want to go to certain people. So I feel like if it's written down, you know, there's no worry. Everyone will have what I want them to have, and that'll be that. And most everything is going to go to my mom, but there's some people that I want to have specific things, and it's just nice to have it in order. It's nice to have it decided and feel like I pass things along that I wanted to pass along. So I think that's kind of a cool thing to do. Um, that is about it for now. I think I'm going to do another video Monday. Today's Friday. So I hope you have a good weekend. If you have anything to say, leave the comments below. Thanks a lot. Bye.